a very big, varied group with incredibly diverse backgrounds and knowledge. But we all need to use the MSK services, which is how we are in part of it.
It's been a fascinating experience to be a patient partner, because being a patient partner at MSK puts you right in the center of decision making, and that's what the MSK partnership focuses on, is patients. It's patient-centered, and it is unique in its approach. And I've been lucky enough to be part of some really groundbreaking work to initiate new processes and systems that make the best use of technology in these changing times. And it's been a brilliant experience.
Yeah, my experience is also, it's given me so much pride that I had sort of almost written myself off as not being any use to anything, because I wasn't really contributing to work and everything because of my health. And this has helped me discover those skills that I had, and feel like I'm adding to society, I guess.
I mean, I just love the fact that this has given me purpose, and I didn't have purpose before. So that's been astonishing for me. But working with this group of people, I just love, because amongst this team, we have so many different ways of thinking about things. We have such a range of experiences that people bring to the group. And it's too easy for people who work as patient partners to be seen as patients rather than to be seen as themselves, with their lifetime of skills that they bring. And that's, the range we have, I think, is just terribly important.
I think it's really refreshing when people come to you and say, well, what do you think? What worked, what didn't work, what could be made better?
This was my first role within the NHS in patient co-production, where I'm drawing on my own lived experience as a patient to improve services. And I must admit that when I first considered the role, I was warned by NHS colleagues from a different organisation that sometimes patient co-production work can just be seen as box ticking, where contributions aren't really kind of meaningfully implemented, but rather it's just seen as something to make the organisation look good. But my experience of being a patient partner within Sussex MSK is I've always felt valued by the staff, I've always felt recognised, and I can, quote multiple contributions I've made that have actually made a difference to the service.
And the biggest challenge that I've experienced has been when I've been observing clinicians in clinics and so on, and it's quite obvious to me that the IT systems, sorry, I'm on IT again, but the IT systems in hospital settings and clinic settings are just not up to modern standards in terms of the sizes of CAT scan files and that sort of thing. And that does impact on the quality of the clinical interactions that the clinicians are able to have with patients. And that I think going forward in years to come is something that really seriously needs to be addressed.
Well, of course, the big elephant in the room is COVID.
One of the most startling and astonishing moments I've had was the first Zoom meeting I joined during the recovery development, when instead of seeing lots and lots of fit, healthy, young people doing all the things they ordinarily do around the MSK building, I was faced with this sea of exhausted people who had just been working so hard and were continuing to work so hard. And it was a real showstopper for me.
But the thing with the COVID-19 is it's meant that we've had to kind of step back. And I've gone into that mode, I'm very aware of it, of people are so busy, the clinicians and everyone has been so busy trying to keep the service running, keep people going. Physios are greatly needed now in the recovery, and how we can be seen as being positive and helpful.
So what I want to say alongside that is, I hope people realise that just how thankful we are for that work that goes on, because the thanks are sometimes, you know, they're not recorded.
I think one of the biggest helps is that we worked on when we actually went and looked at how clinicians were talking with their patients for shared decision making. That was such an interesting exercise, and I think clinicians also appreciated our worth. But of course, we are in a slightly changed landscape, like having to do this meeting via technology.
My challenges, there have been a few challenges that we faced or are faced as a PCP, especially like COVID, which has been a big thing, as Jen said, because I find like with some of the projects that we're trying to do, like consultations for online consultations, has been quite difficult to try and get emails and phone calls and phone numbers for the patients in order to carry out the patient's feedback through virtual consultation. So that has been a big thing, because we've been really excited wanting to go ahead with the project, but we're finding it a bit difficult. I know the clinicians are quite busy and it's a difficult time, but I think the communication between the two would be great if we manage to sort it out. Also, I think maybe balancing the patient's frustrations through self-referral forms, or maybe mechanisms of how patients' appointments work. So there's quite a few things I feel like they should be improved.
For me, there are, when I'm thinking, with the challenges, there are the two things where it maybe makes sense we're not fully in the system, but sometimes there is a bit, because we're not fully in, we don't fully know where to go. And it doesn't matter, even if you're within a system, it takes a while to build up relationships. And that is a problem, even if you're deeper into the system, but you change positions and you have to build up new relationships. And that's a struggle you have wherever you are. But depending on where you are, how you get looked at, that can be easier or more difficult. And especially if you haven't got access to certain information as you're not fully in the service. Otherwise, for me, there's the one thing, and I don't want to see it as a challenge, but I'm sight impaired, so I've got some other issues which aren't really part of what the service is catering for, but the acceptance and the double checking and how to getting that included to make it more inclusive. And for me, the interesting thing here is I've noticed David and we had discussions quite at the beginning, how he could help me, etc. But I don't have to remind David in the same way as so often in other environments I had to remind people.
I think the important thing, I think, is this is value of partners, of patients, that actually that shared decision making work of actually treating people with respect, similar to what Abby said about breaking hierarchies, that okay, this is the clinician that knows more than you, however you know your body better than anyone else.
Collaboration, removing hierarchies, taking things forward into the next century.
I think patient-centered care, empowering patients to take responsibility of their own treatment, and also the partnership between the patients and the clinicians. It's great, yeah.
And so what's been so enlightening and wonderful is that you have the staff who answer the phone, who actually try and fathom their way through and understand what the patients need. And so we've worked with them. I've been on projects working as to how helpful they are. And they want to make everybody's life easy, themselves and for the patients. And it really does work, and you see it in action.
I just hope with making the outside world more aware of us, that others could copy us, what we're doing, and I think there we just then need the help.
How I wish we could clone this service and spread it around the NHS, and also spread the founding principles of the MSK partnership around a little as well, because I think the ethos of the organization is what makes having a patient director and patient partners as successful as it is. And I really do think it is successful in bringing about change, doing things differently, recognizing opportunities, and maximizing those opportunities.